You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back, Health Innovators. On today's episode, I am sitting down with Dave Whelan, who's the CEO of BioscienceLA. Welcome to the show, Dave.
Great. Thank you so much for having me. I'm so excited.
Awesome. So let's get started by telling our audience a little bit about who you are, what you do, what you've been innovating these days.
Great. So for many years, I've said that I am a consultant who basically inspires entrepreneurs at the intersection of technology, health, and wellness. And that's been a journey that I've been on for many years. I think of myself as a technologist. I studied artificial intelligence once upon a time, a long time ago.
Before it was cool.
Before it was cool. So much before it was cool that I ended up becoming an IT guy for a venture capital firm, and then becoming an executive recruiter, and eventually going to business school. So technology guy turned business guy turned health business guy, got into that through the wearable space, and then spent some time in the world of genomics. And before I knew it, I was building businesses and inspiring entrepreneurs at this intersection that pulls in health data and new health technologies, sometimes on the biotech side, sometimes on the medtech side, sometimes on digital health. And so over the years, I'm based in Los Angeles. I've lived in LA for 20 years, but a lot of my time over the past 20 years has been working with organizations and ecosystems and other places. So a lot of time in New York, a lot of time elsewhere, yep. Bay Area, things like that. And every time I came back to LA, I would say, or my wife would say, it's like, hey, why aren't you doing more of that kind of cool stuff here in Los Angeles? And thankfully, a group led by Los Angeles County a few years ago was kicking off an initiative that became this organization, BioscienceLA. And so I joined last year as the first permanent CEO of BioscienceLA to really lead the charge to grow the life sciences and health innovation ecosystem, sort of the innovation ecosystem in the greater LA region, which to me is growing funding, growing space, growing talent, and then growing the entire messaging around that to create awareness.
So what's happening in LA? Are there some different trends that are happening maybe there in that pocket or market compared to some other places across the nation or across the globe?
Yeah, I mean, I think there's I will say there's both a lot and still not enough. And part of what we have in Los Angeles is, we, along with New York, there's a lot of similarities. And since I spent time there, I tend to draw those. We're both massive metro regions, huge populations, hugely diverse populations, and, diverse from a ethnic, racial, socioeconomic background, but also diversity of industries. So I would say, I always point to LA and New York as sort of the two places in the US for sure, where, quite literally every industry exists here. So, people think of Los Angeles as being entertainment, and it is, but, it's also aerospace, and it's also apparel. And then you go a little further afield, it's manufacturing of all kinds. Los Angeles is actually the largest manufacturing hub in the US. And we're also a huge transportation hub. And so you take all of those other industries and you layer this growing life sciences innovation economy, which is not just about biotech. So what I always caution people, especially my board, is that we're not trying to create a biotech hub or biopharma only that rivals the Bay Area or rivals Boston. I think there's a lot of depth there. That's not what we will become. Our goal is, how do we become a better version of the LA that we have, which is this amazing mix of biotech and medtech and digital health. We have arguably the greatest talent and technology around AR and VR for digital therapeutics. And again, part of that coincidentally ties back to the media and entertainment industry that we have here. We've got great AI around clinical trials. And then we've even got some really, interesting leadership around immunotherapies, the CAR T, Kite was founded here and now part of Gilead. And so we've got some amazing sort of not just pockets, but sort of threads of innovation, along with some amazing academic institutions that produce some of the greatest minds in the country. And now we have an opportunity to really help move them into some companies.
Yeah, I like how you mentioned this potential convergence between the creativity of the entertainment industry in converging with the healthcare. I mean, that's so needed.
Yeah, part of it, I certainly use it from the Los Angeles story standpoint, because one of the other messages I've been sort of sharing within the community is, if we want the world to know about what's going on in Los Angeles, we have to make sure that Los Angeles knows what's going on in Los Angeles first. And how do you tell your story so that your neighbors know what you're doing? How do you tell a life sciences story here such that those aerospace people and government people and academics understand what's going on? But broader story about media, I think, is so important. And we've certainly seen the past. Obviously, we've seen so many things over the past year. But I think one of the threads that is very apparent there is this idea of communications and engagement and awareness. And it's we talk a lot about access to healthcare, but you don't even get to access to healthcare until you get to awareness to healthcare, which comes from the right messaging and communications around healthcare. And if we could channel the media and entertainment industries to actually be more partners in that, there's a huge opportunity, not just for LA, not just for the US, but for the whole world, in terms of how new innovations are shared, new challenges are shared, and people actually take action.
So let's talk about that a little bit. Let's just jump right into the meat of it, right? We talk a lot about commercialization here. How important, like what's happening from your perspective around the communication and the media and the awareness and the messaging and value props and all of that stuff. And what do we need to do about it?
Yeah. So I use a couple of examples, and one is sort of, I'll call it more on the consumer side of health and wellness, more on the wellness side. So if you look at the past 10 years, companies like Netflix have been, I think, very active in the documentary space. And if you'd asked me 15 years ago, do people want to see a documentary about nutrition, I would have said, I don't know, maybe one, right? And Netflix has produced like 25 documentaries about nutrition over the past, several years.
My husband came home last night and said he's no longer eating seafood because he just watched this documentary on seafood last night with Netflix.
One of the companies I'm advising just recommended I watch that documentary and said it's very good. They're working on a cell-based meat technology for bluefin tuna, and they're developing this here in Los Angeles.
Okay.
So that space is another interesting. We could talk about synthetic biology too, but on the media side, so you've got communications sort of from that consumer media side of things, but we also continue to be in this mode of as much as I think everyone thinks about we Affordable Care Act and sort of acts like that's been here forever, and sort of consumer access and awareness to healthcare has been around forever. We're still in the early stages of that, and it's continues to evolve. And so the more that we have consumers making decisions about healthcare, asking questions about healthcare, the more we have consumers with access to phones with data, with access to wearables with data, whether they're consumer-facing tools or more like diabetes technologies, things like that. The more those are out there, the more there are questions coming from both patients and consumers, whether it's family members or just other consumers. The more we need to find ways to get information in a timely fashion, in a sort of packageable fashion to individuals so they can understand it. And some of that is Some of that is how do we, embrace TikTok or Snap or whatever the new technology of the day is. Some of it here in LA, we have a few companies, one called Impulse Mobile that works a lot with text messaging. So text messages that come from your physician or text messages that come from a company like Medtronic to a physician or to someone within a hospital that's helping to guide them in what they should be doing. We have companies that are producing video content for patients. A company called ModiSpark that's really about sharing these what they call sparks, basically these little bursts of inspiration or bursts of guidance that will help people do the right thing, which might be, how do we eat today? It might be, how do we exercise? It also might be, did you take your meds, or did you remember to go back for the second vaccine shot, or things like that. There's a lot that we can do just in terms of connecting with people where they are in the voice that they're expecting, which again is, as we talk about diversity in Los Angeles, that voice is many, many languages. It's many, many approaches. It's being in the right place at the right time with the right message and approach to help people make a better decision.
Yeah. So Dave, how important is this to the commercialization process, and where are we getting it wrong? Like, where is it, what are we doing incorrectly that we need to recalibrate or reset?
Yeah, it's a great question. And, especially here in LA, because I see both sides. You look at sort of the traditional if biopharma is kind of the traditional side of life sciences innovation, and then digital health is, clearly the newer side.
Yeah.
I think it's, not black and white, but I would say, in some ways, the biopharma space is more of the old model, which is, clearly trying to solve a problem in the end user, but not necessarily for the end user. So it's trying to tackle a disease or something like that, but not necessarily understanding who that end user is, how they will relate to it, and some things like cost come into that certainly, and challenges around that. But I think as things go more digital, we see companies that are taking more of this design thinking viewpoint, this user-centered viewpoint, and that's not always right, because I think sometimes we end up with the complete other side of the pendulum, which is we have technologists sort of working on the user and really understanding the user, but then somewhere in the middle they've missed actually solving the problem, right? So it's like
the business component. You got
the business, right? Yes.
Small group of customers says they love and they'll buy, but really they're not going to buy.
Right.
It's not viable or feasible for the business. Yeah. Mm-hmm.
Yeah, exactly. And so I think clearly we understand where we want to go with that. What I think is great that I'm seeing more of is some of those traditional companies, whether they're biopharma, whether they're big device, and companies, are teaming up with the digital companies and finding ways to use some of the data coming from digital health to help inform the development process of things. Clinical trials is one where we've seen huge strides in recruitment of clinical trials, and companies like Apple is involved in clinical trials through their research kit product, and companies here like Science 37 are involved with getting a better population of clinical trials faster, or even virtualized patient data, randomized patient data, things like that. All of that can help to move that process forward faster and start to get to solutions faster. And hopefully, again, the past year, so many examples there, whether it's the move into telehealth, telemedicine finally, or patients understanding that if they have some kind of data, and that data might just be temperature, might just be how you're feeling, but now there's finally ways for a patient to take something happening to them and get it to their physician that doesn't involve a fax machine anymore, and that's pretty exciting. That's a huge boost of productivity, I hope.
That's a whole nother episode, Dave, the whole fax channel.
What happened to the fax machine, or what's still happening to the fax machine? Yes.
It's ludicrous. But in some ways it can still be effective. It's just embarrassingly effective.
Right.
Yeah.
Well, now, of course, now the biggest challenge is, on the consumer side is, well, where do you find a fax machine to actually fax something to the doctor, right?
Right. Yeah, exactly. So, from your perspective, what do you think is the number one strategy that's really mission critical for commercial success?
Yeah, I think this is maybe the easy answer, but I always go back to that early stage of how do you understand, how do you get to product market fit, which is really how do you understand who that customer is, who the customers are, and that again, that could be from on the enterprise level. You've got the financial customer, you've got the executive decision-making customer, you have the customer is actually using it, maybe you have the end user patient, but really taking the time to understand who those individuals are, who those personas are, really understanding what their individual pain points are, and they're probably different across those, and then making sure that the product that you're developing is eventually going to address a lot of those, but it's also not going to address a lot of those on day one, because if you try to do that, you're never going to launch this product. So where do you want to go? And then, move it back to whether you call it, minimum viable product, or call it your just, early beta, pilot sort of opportunity, but making sure that there's a real storyline there. Where do you want to go? Where do you start? And how do you know that what you're building is actually going to help doing that? And I think that, I've worked with a lot of companies that are sort of in the, I'll call it the venture or wannabe venture, future venture-backed world. And then I work with companies that are going through NSF and NIH, SBIR grants and things like that. And, interestingly, the NSF in particular really has a strong process around that early data gathering, understand the market, interview customers, things like that. And if you're going through an accelerator program, a Techstars program or something like that, Y Combinator, they do a really good job with that as well. Sometimes when you're an entrepreneur or three entrepreneurs working on a tech startup and you know where you want to go, or you think you know where you want to go, and you start building it, those are the groups that sometimes forget to talk to the customers, until they're in front of the venture capitalists asking for an investment. And the VC says, well, how many customers have you talked to? And they sort of look around and say, well, my brother would really love this product.
Right. Exactly. Oh my gosh. We talk about that all the time on this show. This is like one of my soapboxes. So I'm going to ask you, so I face this more than I would ever want, is that you have the innovator. They are so committed and somewhat obsessed with the innovation in the configuration that they believe they want to bring to market. And, they've had some conversations with people, like you said, people say they love it. People say they will buy it, right? But no hard data to validate the demand for it. And they skip to, can you help build a go-to-market strategy and plan? Can you help with digital advertising so we can build awareness? What do you say I'll tell you what I say, but I want to know what you say to those folks that really want to skip all of these really key steps. What do you say?
Yeah. Well, first of all, I have a little side story, because I remembered this with someone I was talking to a week or so ago. Many years ago, when I was graduating with my artificial intelligence degree and trying to figure out what I wanted to do, I was interviewing with an educational software company it was for a product manager, product assistant, manager or whatever role. And I remember sitting across from the interviewer, who was like the head of product for the company. And, we're in the heat of the interview, and he says, Dave, if I gave you a piece of paper, could could you map out a product plan for a new piece of software, a new app we want to do? And I, of course, I was 21 years old. I'm like, oh, this guy I need to know how to do this. So I'm like, well, yeah, I would, and I started to like do something. And he's like, it's like, Dave, no, you could not do that. Like, you do not have any of the information to do this. So do not jump into that. And I feel like that's what these entrepreneurs are like sometimes. And so I really do, tell them to stop, slow down, and, let's again, understand, do we know where we are today? Do we know where we want to go? And do we know how we think we'll get there along the way? Especially knowing that ultimately, even if you have a really good plan based on data, based on customer feedback, invariably you're going to take a turn along the way because you're going to realize that something that even if you plan it really well, something you thought was correct is not there. So even if you plan really well, you're still not going to take a straight line. Clearly, if you don't plan at all, you're absolutely not going to take a straight line. And maybe your line is going the wrong direction. And so, I do
millions of dollars on something that nobody wants.
Right. I do send a lot of people back to the drawing board. And I was talking to some entrepreneurs recently where they're again very, very passionate, and they're talking, and this is all over Zoom, of course, so it's a little harder, but they're talking about what they're doing. And then I was just like, look, there's clearly an opportunity. I know there's a need in what you're talking about, but like, I don't think you even have a product here yet. Like let's figure out, like, we know there's a problem. Now let's figure out what we're building that's going to address that problem. Not just, hey, there's a problem, let's get in there because we can fix the problem. And I think that's the difference between sort of, if you are a technologist, sometimes there is that, I guess it's the mechanic versus the engineer sort of mindset, right? And like sometimes technologists act like mechanics, and like we need mechanics. There's there's lots of places where mechanics are needed, but you don't tend to build a company based on being a mechanic. You build a company based on being an engineer, even if what you're engineering is actually something that other people use as a mechanic for their problem, but you still need to engineer a product, engineer a business, as opposed to trying to fix someone's individual project or problem.
Yeah, absolutely. So, two things come to mind. One is that, just acknowledging it's hard, right? So it's so much easier for us to give that wisdom to other people than to take it for ourselves, right? I mean, literally, or maybe not so literally, but like left a presentation that I gave on how important it is to co-create with your customers, and then went into the R&D room and started innovating the strategy product that no one had ever validated, but I was so passionate and so sure that everybody was going to want it. And it's like, oh my gosh, it's just hard.
As I like to say, I'm very good at giving this guidance to people because I've had lots of personal failures where I've totally missed that. So I definitely know what happens when you fail there.
Right, exactly. The other thing is, sometimes, when, and I'm sure you face this too, is that when you get people that are just digging their heels in and they're so strong, you just have to say, well, then I'm not the right consultant. I'm not the right strategist for you, because I am not going to, I won't be able to sleep at night if I'm part of you pouring money into building an awareness campaign for something that I really think has no chance of success. And I'm sure you'll be able to find someone else that will waste your money, but it won't be me. Right.
I've definitely used that before. And then, of course, there's the ones who they look at that as reverse psychology, and they say, oh, no, I will change my ways. I want to work with you. So sometimes it actually works in the end.
Yep, exactly. You're right. It does. Sometimes it doesn't. And sometimes I'm like, all right, come back and see me in 2 years. Oh, yeah.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit.
Let's talk about some of the, and you can kind of pick which ones you want to talk about, but what are some of the myths, barriers, or pitfalls of commercialization that we haven't talked about yet?
That's a very, very, very good question. And I think I touched on a little bit, but I think it bears repeating this idea that you need to understand what the fully baked product, and not even the fully baked product. I feel like a lot of entrepreneurs feel like they have to understand what version 3.0 is going to be exactly before they've even launched, beta 0.1. And so I think, and again, part of that might come from people like us talking about understand the customer and plan and make sure you have this whole thing, and they sort of take it to the extreme. And so part of it is you nobody knows what version 3.0 is going to be, absolutely. And so, have a North Star, which might be version 10.0, but then you've got to work back and you're really focusing on how do you get from, pilot to beta to launch. And so, think big, but then plan small and incrementally. I think that's one of the things that gets people hung up.
It's funny. That reminds me, I had Frank Ricotta on the show a couple of months ago, and he was getting a lot of feedback, not necessarily from customers, more so probably from his board and his investors. And after several years in, he was looking at like his original business partner and said, you know what, this is really not even the business that we want to be in. Like, what happened? How did we get here? So they were listening, but listening to maybe some of the, I don't want to say the wrong people, because they absolutely should have a voice. And then he completely pivoted about a year ago and said, no, I'm getting back to my North Star. I'm getting back to the dream and the vision that I had originally. And he's been doing tremendously well the last year.
Yeah, exactly. And I think those, taking time to realize those, and sometimes taking time to scrap what you've been doing for the past month or the past year, it can be hard, but it's also essential.
Very hard.
I think one of the other myths, especially with early stage companies, is that competition is bad, or when you're working, you're kind of heads down working on something that you think is this innovative new mousetrap, and then you kind of put your head up and you're like, oh wait, they have a new mousetrap and they have a new mousetrap, and some people look at that and say, we're done. We shouldn't even be working on this. And, that sometimes that's true, but I tend to use that example with entrepreneurs to say, well, first of all, this clearly means that there are people out there who are looking for better mousetraps. So we're in the right business. Like, this is the right thing to be working on. And, and then it comes down to, maybe they're not in exactly the same market. Maybe they aren't even going to execute on this. Maybe they've just, announced this vaporware thing that will never come out. And so if we can actually build this and do what the competition has now just gotten the public excited about, then we're going to be huge winners here. And so that whole idea of like, don't quit just because, even if it's exactly the same thing, because sometimes exactly the same thing never comes to market, doesn't actually work, or eventually people don't like it and they like your product.
Yeah, I mean, that is so true. I mean, look, McDonald's, Burger King, and Wendy's, some kind of way, they've carved out their space, their market, their customer in a very commoditized market.
Yeah, exactly. And I think there's even more, that's a great example, because you've got those, but then you've got, then you could put in like the, Chick-fil-A or KFC or whatever. And so there's these, are we talking about competing with restaurants? Are we talking about competing with a kind of food product? And so it's like you look at, especially in digital health, we have, a huge number of chronic disease management, tools, platforms, resources out there, and more every day. And so that looks like a crowded market, but it's also, there's continuing to be new entrants and obviously a lot of, M&A and shifts going on. And then, are we talking about chronic disease management, or are we talking about a solution for diabetes, a solution for obesity, a solution for living with cancer? And so, you could take any one of those. You could take the top level, you could take one of these niches within it, you could take that for a certain population, you could take it for a certain geography. I think there's massive opportunities if you find find that right niche in a very big market.
Yeah. I'm so glad that you brought that up, because I do think that is a strong myth. I talk to a lot of people that think that being first to market is the winning strategy. And they really overlook a lot of the advantages of being a follower, or even being a late follower. I mean, one of the advantages that comes to mind is you get an opportunity to see what worked well and what didn't work, and then carve out your competitive advantage in that space. Or you might even had someone that was first to market that went through all the expense of creating that new market category that you don't have to fork out now. Right?
No, absolutely. And I think, I'm a big Apple user and Apple fan as a business, and sort of Apple, for as innovative as people always talk about Apple being, in some ways Apple is most famous for taking 5 or 10 technologies that are already out there, already proven. They package them together. They add a little bit of magical pizzazz around it for sure, and then that's their product. And I think so many times, the Apple Watch and the iPhone before it and things like that were examples of, this is already out there. It's just nobody cares because it doesn't work quite well enough. And it's about that, repackaging it with a certain brand to it. And I do think there's opportunities there where there are products, there are products that are out there that are perfectly serviceable. Nobody is really complaining about them, or not loudly complaining about them. You can look at it and say, if we just added this little piece, which is missing, but nobody even realizes that, it's going to open up a whole new market. And I think those are the kinds of things where, as you said, you can look at somebody else's example. You can make sure you don't make the same mistakes they made, or even like you can ride on their marketing dollars. I mean, there's a lot of examples out there of just being able to. This company is spending a lot on marketing, and they're making the public, the consumer, the user aware that this is an opportunity. And now we come in with a slightly better product, and we don't spend any money on marketing, and people love us because they're looking for a solution.
Right. Exactly. Yep. Let somebody else foot the bill for creating the demand.
Exactly.
So you mentioned product market fit. And one of the things that I don't think we've ever really done on the show is really talk about, like, what is product market fit? How do you get to product market fit, and how do you know that you've gotten there? Because, it's kind of a real popular buzzword in these incubator, right? In the communities that we are in. And I don't know that there's a real clear understanding of what that is and how to get there and how to know that you're there.
Yeah, and that's it's and you kind of hit on all the key questions and challenges around it. And I actually do think that sometimes there are probably investors who are sitting across from entrepreneurs saying, you've got to get to product market fit, and they don't even necessarily know what that means. And I mean, in my mind, it's as simple as you've got something, or you're building something that works, that meets a need, and that the person whose need it meets will actually pay for it. And that's kind of, I think that's the the simplest term. I mean, go to like a super simple business, a kid's lemonade stand, right? I mean, so like, do you actually have the product? Like, I mean, if you have a lemonade stand and you're selling iced tea, you're selling water, you don't have the product, right? And then is there a market for it? Are people going to be walking by? Are people going to see it? Do you have neighbors? Do you have friends? And then even if you do, like if you have the lemonade stand and the lemonade costs $10, nobody's going to buy it. But if it costs $1, people are going to buy it. And I think when you kind of make it in those simple terms, I mean, clearly it's a lot harder when, again, I think to the point of what is the product supposed to be if the customer doesn't even know what they're missing. So you still have to figure out what the product is. Is there a customer, again, in the world of healthcare? Hugely complicated because you have patients and physicians and administrators and the CFO, and you have the payers who are potentially involved in this. You have the government regulators who are not necessarily the customers, but they're part of that, the launch thing. And then there's the, will they pay for it and how much will they pay for it? And especially when you're creating something that's brand new, it's a real challenge, especially especially in healthcare. When I've worked with the Cedars-Sinai Accelerator here in LA, the easy advice I always remind all of these entrepreneurs is, a hospital is going to look at something and ultimately buy it if it's going to save them money or help them make more money. And making more money is by delivering quality care more efficiently, more effectively, so that there's more of that, right? So that sounds really simple, right? Either make money or save money. But then, what does that actually mean when you're trying to insert something into an existing system? And maybe at scale, if everyone in the organization is using it, it will save money for the organization. But how do you even get someone to look at it when the only way for it to get to that point is to be installed across the entire organization, to be in use in every department or to be in use with every physician. And so that's where piloting can be so important, and finding some early adopter, does the ED want to look at this, or does urology want to take this on and test it? And if they get results there, that can lead to one, understanding that product market fit, sometimes understanding, like your example a few minutes ago, wait, we're in completely the wrong business, or the problem is what we thought, but like what we're trying to do is completely was completely wrong. Let's change dramatically. And I think there's a lot of opportunities if you get into the right accelerator program, work with the right advisors. They can help guide, especially in healthcare, help guide to those solutions, so you're not out there trying to sell something that ultimately, nobody's going to buy because, nobody wants to pay for it. There's no customers out there. And in fact, the product isn't even the right thing.
Yeah, exactly. I love your lemonade analogy because I think it really breaks it down in simple terms, right? The whole idea of reality of healthcare is just so complex. But thinking back about the lemonade analogy, I go back and go, okay, well, if you shut down the lemonade stand, does at least 40% of the people in the neighborhood care? If nobody cares that you shut down the lemonade stand, you really don't have product market fit. Nobody cares whether you close the shop or not, right?
That's the best addition to that. Yeah. Do people show up in the morning before you even set the stand up because they want it? I like that.
Right. Yeah. And going back to your Apple story, you think about product market fit. And all of the people that were standing in line for days for the next iPhone, and just, talk about product market fit and being able to confirm that you have it.
I will say, I'm a huge Apple fan, but I've never actually stood in line for an iPhone. So I guess maybe I shouldn't say that. I guess I'm not as big of an Apple fan as I lead people to believe.
Right. Yeah, me either. I'm actually probably I think that diffusion of innovation curve, we can kind of fit on that continuum based upon different scenarios that we're talking about. And when it comes to, I'll be candid, when it comes to the Apple phone, I'm a laggard because I just got one like a year ago. I've been a Droid fan, like a staunch Droid fan for so long. The only reason why I even converted, I've had a Mac laptop for years, but the only reason why I got the iPhone is because I wanted the darn Apple Watch. And so I had to finally give in.
That's the kind of, that's the next level sort of marketing thinking that Apple does, because
Right.
there are, and and there are, in fact, you're right, and there are people who have bought Macs because they started to use an iPhone or something like that,
Right,
and so
right,
they have a great way of doing that.
It's a great product strategy, right? So before we wrap up, I want to just kind of give you a little bit of time to talk about BioFutures and what's happening there. What should our audience know about what's happening with that program that you're launching?
Yeah, no, and I'm very, very excited, and we just made a major announcement around. So within BioscienceLA, within the LA region, especially long term, the biggest driver of success in the industry, I think, is people, and having talent who can not just help develop your products, but help build them and market them and sell them and fix them. It's the entire kind of talent spectrum of an organization, and so and that's even more important. Again, I'm going to use my third time to use the example of over the past year, because we've gone from a healthcare crisis, which has led to an economic crisis, which has been exacerbated or amplified by multiple social crises, and especially in Los Angeles, that is so visible and so interconnected, and especially around healthcare. And so last fall, we announced a program called BioFutures, which is a subsidized internship program whereby we're connecting with students from underrepresented populations, community college students, four-year college students, bringing them through an application process, helping to connect them with life sciences, health tech companies in the LA region for summer internships. And then we're subsidizing the majority of the internship because there are still a lot of companies that either, don't or won't pay for interns, and especially startups where, every dollar is precious. And you're like, we need help, but we can't, we can barely afford, desks. How can we, or we can't afford a desk for an intern. But so we want to make that easier. And so we have, students applying right now. We have, I think, students from almost 20 colleges in the LA region who are part of our database now. And we just opened the database up to companies, here we are in mid-April that we just introduced companies to the database, and they're already, starting to interview students. And our goal is to be able to bring hundreds of students through a program like this over the coming years, with this idea of every dollar we're spending on this it's an investment in the student. Certainly, it's also an investment in their school, because the school is sort of getting credit for having the student. That's kind of the workforce talent development side of things, but it's also an economic development program because we're also investing in the companies. And so I was talking to someone yesterday, and I said, if we're spending, an average of, $5,000 per intern, if we have 100 companies that are doing this over the summer, that's like BioscienceLA has made, $500,000 of investments into the startup ecosystem.
Yeah.
And so super excited about that. It's, this is obviously very LA focused, but, we're, certainly there are a lot of companies who are outside of LA with operations here. And so if they end up hearing this, we're certainly happy to talk about how we can maybe get an intern in there.
Yeah. Okay. So you heard it here. If you're listening, you're watching, and your company is based out of LA, reach out to Dave and see how you can get an all expenses paid intern.
Yeah, I'm very excited about this. And it's just one of many programs we're launching around sort of the entire commercialization spectrum that you mentioned, which is all about how do we go from academic innovation to startups to early stage funding to later stage funding to IPO or acquisition, or I guess SPAC. We should throw SPAC in there now. Like, everyone has their SPAC dream, but whatever it takes along the growth spectrum.
Right. Okay. So we're at the end of our time here, but I feel like I would be remiss if I did not give you an opportunity to share this fun fact about yourself that has to do with Shark Tank.
Yeah. So a fefew minutes ago, we talked about, I said a lot of the guidance I give entrepreneurs is, from failures. And so, so several years ago, I was working with an entrepreneur. He was an advisee, and then I ended up becoming a co-founder. And we had this amazing consumer health tech product. And this was a case where the market was clearly there. It turns out the product was not there. So we had a market, we had the story, we just didn't have a working product.
Yeah.
As I so learned eventually. But I actually pitched Shark Tank in Las Vegas during the Consumer Electronics Show and made it through that round, made it through a couple more rounds. And we actually we were in dress rehearsals for Shark Tank, which meant that like the following weekend, we would have potentially taped for Shark Tank. And even if you taped for Shark Tank, doesn't mean you actually end up on the air, but we were super close. I even had my now 10-year-old son, who I guess was like 5 at the time. He was going to be on there with us because this was it was a wearable thermometer. And so my son, I was putting the thermometer on my son, and so we made it super, super close, but did not. And so this is kind of like the fish, talking about the fishing trip where the fish that got away or whatever.
Right.
The fish was this big, and I'll tell you.
So exciting. It's so exciting. It was so close.
But thankfully, I've worked with some companies in the ensuing years who actually have made it onto Shark Tank. And there's some very cool, healthcare related companies in LA that have, been Shark Tank. Gotten investments on Shark Tank.
I've seen those episodes. Yeah, that's great. Yeah. It could be, like you said, it could be the ones that they did it and it just maybe didn't air. And I'm not watching every episode either, but they do some good stuff there.
They do, but you do learn a lot about like there's a long document that I probably shouldn't talk about that basically says if we taped you might or might not make it on the show. Like you could get an investment and not end up on the show. You could obviously not get an investment and end up on the show, because ultimately it's television and they're looking for good guys and bad guys and winners and losers and everything. So it's a fascinating process.
Man, that's awesome. So I'd love to have you back on the show. I think there's so much we can talk about, and maybe we'll be able to dig into more some of those learnings in that Shark Tank journey. So Dave, how can our audience get a hold of you if anybody wants to follow up with you after they tune into the show?
Sure. So definitely check out BioscienceLA.org, which is my organization's website. And then on social, I am DJ Whelan, DJ Whelan, on pretty much everything except for Snapchat, where I didn't get that. And it's okay because I've never used Snapchat. So do not contact me on Snapchat because I will not find you.
Right, exactly. So thank you so much. It's been a great conversation today. Thanks for your time.
Yeah, thank you. Thank you so much. A lot of fun and looking forward to coming back. Thank you.
Awesome.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.